Greetings. Today's video on troubleshooting with channel videolaryngoscopy. In spite of having good view, if you are not able to negotiate the tube with the larynx with the channel blade, this video is for you. So with the channel blade, when you are trying to intubate the patient, your tube can get lodged, can get impinged, can get resisted anywhere over the larynx, either on the right area epiglottic fold, left area epiglottic fold, epiglottis, or interarytenoid tissue. You have to overcome this impingement. Let's start looking at the different videos. So this video is showing impingement of the endotracheal tube with the channel blade over the right area epiglottic fold. So how to overcome this? What to do? So to overcome this, you have to withdraw the endotracheal tube 1 to 2 centimeter and rotate endotracheal tube 90-degree anti-clockwise rotation inside the channel and then advance the tube to the larynx. This is how you can overcome the right area epiglottic fold impingement. And you have to exactly do the opposite maneuver if your tube is getting impinged at the left area epiglottic fold. So this maneuver, I'm showing another video for maneuvering the tube anti-clockwise rotation inside the channel for right area epiglottic fold impingement. Or else what you can do, rotate the screen toward the side of impingement. This will align the tip of the tube trajectory with the larynx and then advance the tube inside the larynx. Many times your tube is getting impinged the interarytenoid tissue. What to do? In such case, just lift up the scope skyward. You'll be able to overcome this problem. This is tricky situation. When your tube is getting impinged at the epiglottis with the channel blade, what you have to do? You have to withdraw the tube little bit and you have to rotate the endotracheal tube 180-degree inside the channel, get underneath the epiglottis, then re-rotate and advance the tube. It's the most trickiest impingement to overcome. Many times your tube is sliding into the esophagus with the channel blade. Then how to overcome this? What is the reason of sliding the tube into the esophagus with the channel blade? Suppose this black mark is larynx. So if your tip of the videolaryngoscope is too near to the larynx, what happens? Because of shape of the tube, when you are sliding the tube will go down into the esophagus. But when you are keeping the distance from the larynx, because of shape of the tube, when you are sliding down from the channel, it will go towards the larynx. Now, many times what happens, in spite of doing lot of maneuver, you are not able to negotiate the tube, endotracheal tube inside the larynx with the channel blade. Either it is going down into the esophagus or impinging anywhere over the larynx. So what to do then? Then you have to apply a hybrid technique. What you have to do, keep the videolaryngoscope with the tube in C2 on the channel. Withdraw the tube little bit, 1 to 2 centimeter away from the larynx, and then insert the flexible endoscope, fiber optic scope, through the tube and get the flexible endoscope inside the larynx. And once the flexible endoscope inside the larynx, over the flexible endoscope, railroad the endotracheal tube inside the larynx. That's called a hybrid technique. So this is how you can overcome the different impingement of the endotracheal tube with the channel videolaryngoscopy. Many people are facing the problem of fogging. What to do with the fogging? Insufflate the oxygen through the tube which is loaded on the channel with the circuit, or insufflate the oxygen through any possible route will remove the fog. Or else you can apply anti-fog solution over the camera. It's commercially available. Or else change the blade to a newer blade. Specifically in obese patient with enlarged blade, the screen is touching the chest wall. You are not able to insert the blade into the mouth because it's not getting the curve because screen is touching the chest wall. In such case, remove the screen, insert the blade and reattach the screen. That is how you can overcome this problem. So that's about the troubles and troubleshooting with the channel video laryngoscopy. So we'll be having a next video on with the session 3B with the troubleshooting video laryngoscopy with hypereglottic blade. Thank you for watching this video.